All right, everybody. Glad to be here with y'all. I'm the product manager on the QMR application. Here, going to show kind of a live walkthrough of a lot of the things that were just covered in the slides. Really just to highlight the changes in real time that have kind of occurred over the application in this reporting year. So first off, we're on this landing page where you first come to when you first log into QMR. A couple of things I want to note that were covered previously. You'll now see a banner above that is just noting that FFY 2024 is available, but also noting, as Talia had mentioned, that any changes made to FFY 2021 through 2023 will be saved, but won't be included in public reporting. And that's really important because the application itself does allow you to kind of navigate between years. As Talia had mentioned previously, the reporting year you'll see if you were to log in today would be 2024. It's defaulted in. But if you were to click here, you can see that you can navigate to any of the previous years as well. One of the things that we wanted to highlight here was just the big change that occurred here is you're no longer going to be required to select which version of the child core set or adult core set are going to be reported on. We'll be defaulting that for you on a state-by-state level. So as soon as you log in, you'll see the core sets that are required. If you have any health home data to be added, you'll still see this option down below. And when you click into that, you'll be walked through the process of adding one. So I'm going to go ahead and add one here so you can see it added to the dashboard. So as you can see, this has been added. And again, if it needs to be removed, you'll go through this process. As Talia had mentioned, deleting the core set will delete any of the measures or data that have been input already. So we do have kind of a confirm here where you have to type in delete to confirm that you're willing to do that. But once you go through that, you'll see it is removed. Before we jump into kind of the core sets themselves, one of the things that we want to note, and this is becoming less and less prevalent, but it's always important to note, the application itself will work on most major browsers. So if you're using Firefox, Google Chrome, Safari, or Edge browser, you will probably not run into any kind of issues. If you are somehow using Internet Explorer still, that is not a supported browser. And so you may run into some funkiness there. So that's just something to note. If you see anything weird, it's possibly because you're in Internet Explorer, and we would encourage you to use any of the other four supported browsers that I had just mentioned. Alrighty, so I'm gonna go ahead and jump in. We're going to go into the adult core set here, and one of the things we want to note is, as we had mentioned, there are some mandatory reporting measures this year. So you'll see that there is a banner that's included on the top of all of the core set pages that tells you some information related to mandatory reporting, as well as a link out to initial core set mandatory reporting guidance. To enable y'all to have a more visual output of what is mandatory, we've added this mandatory token that exists. If you go to the child core sets, and I'll show that in a bit, you'll see that all of them are mandatory. But especially in adult, we want to make sure that we're creating a very visual representation of what is mandatory, what is not considered mandatory for this reporting year. So you'll see this mandatory token next to any specific measure that is considered mandatory in the adult core set this year. And one additional note that we want to make is that the core set qualifier questions are accessible via this link at the top of each of the core sets. Now, this is really important because what you'll see is we do have a counter here of total measures completed. And as you complete the measures, this will increase and show completion till it gets to, in this case, the 33 count. However, submit core set will not be enabled to allow you to submit the core set until you've completed all measures or answered all measures and completed the adult set qualifier questions or any of the core set qualifier questions. Just a reminder that you do need to come in and click this and you'll be taken to the qualifier questions. All right, we're going to go ahead and jump into one here. So this is CCSAD, and what we really want to highlight here is just the need to really make sure that you're completing the measures in order from top to bottom. And as Talia had mentioned, there are separate parts of this report that are the measure itself that won't show until certain questions are answered. So as you can see, if I scroll down here, I haven't answered any of these other questions yet. And I kind of get down to the bottom here, and it seems like it's missing maybe like the NDR set. So to get there, you need to make sure that you're answering these in order. And so we'll go ahead and go here, select our measurement specifications. And as you can see, once I've done that, you can come down and there is additional questions that are entered in. So again, really important to make sure that you're going through the measure in order to make sure that there's no questions that are being missed. So I'm going to go ahead and come over here and just kind of quickly go through here and add a couple of answers. And as you can see, this is an administrative, so I cannot edit. But if I were to come back up and change it to a hybrid, you can see that this field is now editable. So that is a change between those two types. So one of the things that we had noted was kind of avoiding that hard stop that can exist from a validation standpoint. So this is a really good example of the kind of validations that could come up on a very incomplete measure. I've not answered quite a bit of these questions. So if I were to come down here and hit validate measure, you'll see I have quite a few errors that I need to come back and fix. So you can go back up into the measure and correct these specific errors. But if you run into a situation where there is not an answer for that in the situation that was mentioned around the numerator, you can come to complete measure, and what you'll be prompted to do is accept that there are still errors on this measure. It will allow you to complete it though. So really highlighting that not a hard stop exists here, that we're going to allow you to go ahead and complete that measure. So in this case, I'm going to go ahead and hit yes. Now that process of completing the measure, it's really important that as you're going through the measure, you are coming down and making sure to hit complete measure. The report itself will save, and there is a save option up here. Saving it is not completing the measure. So you want to make sure that when you're done with it, you come down and you hit complete measure so that it sees the measure as a completed measure. You can see the status updated here, and you can see that the count has been increased from 2 to 3. All right. One of the things I wanted to come back and note here is kind of the trickle-down effect of information entered, right? So when we come in here, you see that I had to get to this specific part of the measure where we're able to enter in the NDR, and the impact that that has when you come down and start to get into measure stratification is that those exact same rates are going to be pulled through. So for each of the individual stratifications that exist, those specific rates will be pulled through to allow you to enter in that information as well. Right. Go ahead and complete that. Alrighty. So one of the big things that was mentioned as an addition this year is that addition of the combined rates page. So we're going to come back to the landing page, and you'll see that we have the combined rates button located here. As a user, you can come into this at any point. You don't necessarily have to have completed any of the measures themselves. However, you won't see calculations for any measures that are not completed. AMBCH is a good example. I haven't completed that measure. When I come into it, you can see there's not reported and not reported showing. So this is kind of the default state that you'll see for measures that are not completed or haven't been started yet. As Talia had mentioned, we made sure to allow users to access these specific measures that feed into this combined rates page by accessing them on the page itself. Again, if you click it, it will open in a new tab, so not to disrupt you from that flow and make you go away from that page. If you close it out, you'll be right back on the page. That's very helpful. Now I kind of want to show just a couple of examples of how rates are calculated in the combined rates page and show kind of the variance that can exist here, because the way that it's been set up, it really does take into account a lot of different factors to ensure that the appropriate, accurate calculation is taking place. One of the ones that we just talked about was CCSAD. So you can see here, this is a hybrid measure, and so it has a unique weighted calculation. And this information is being pulled directly from the measures themselves. So as you can see, these are not editable fields, but if you need to go in and make any adjustments after reviewing this page, let's say my numerator was 5, not 4, I can go into the measure itself, go ahead and scroll on down, make the change, And again, ensuring that you complete the measure is really important here, because when you come back into these measures, if you make any changes to them, it's going to consider them in progress again. So in order to keep that completion intact, we'll want to make sure to come back here and complete measure. So we'll complete measure. You come back here, you can see that that number was changed in real time to reflect on the combined rates page. This is an example of a hybrid measure. I'm going to now show a more standard calculation. Let me pull that up real quick. Actually, so this is a more standard calculation. So as you can see, the separate chip one is not reported yet. That measure hasn't been worked through, but this only includes the numerator, denominator, and rate. When I do the separate chip one, you'll see the same thing done, and then the combined rate will change to be calculated against both of those data sources. And then one last one that I want to show, because there is some variance here, is PCRAD. So in some of these, the combined counts is a sum count across the totals, right? And for this particular report, if we were to go into it, you can see that the way that we're capturing a lot of this information is very different than the NDR sets of other measures. So being able to still provide that combined rate calculation or the combined sum calculation for a lot of these was something that we really took into account and wanted to make sure that we were providing accuracy around on the combined rates page. So if you come back to it, you can see that we've brought those in accordance with the way that they're captured in the measurement itself. So you'll see accuracy in what's being shown across the different measurements. And with that, I will go ahead and stop sharing and hand it back to Talia. Thank you.
Perfect. Thank you so much, David. Okay, we can go to the next slide. Grace, if we could go to the next slide. Perfect. Okay, we will now review some reporting resources that are available to you as you enter your data in the QMR system before we turn to questions. Next slide, please. Reporting resources for the FFY 2024 core sets can be found on Medicaid.gov and in Appendix C of this slide deck. These resources include many helpful links, including measure lists, technical specifications, the data quality checklist, and measurement period tables. Next slide. There are also teams available to help you if you run into any challenges while reporting in the QMR system. For technical questions regarding use of the QMR system, please reach out to the MDCT help desk. For TA related to calculating, reporting, or using the core set measures, submit your questions to the MAC Quality TA mailbox. Contact the TA team at the data preview mailbox to ask questions about your state data preview or to set up a meeting with the TA team to discuss the preview. In addition, the QMR Help Desk team will host an office hour this fall, so stay tuned for more information. Next slide, please. And finally, here's a list of appendices in the slide deck so that you can easily find your way to the resource you need when it is posted on Medicaid.gov. Next slide. Thank you all for attending today's training session. And remember, if you have questions, reference and TA resources are readily available on Medicaid.gov, or you can contact our team. Next slide. So I'm now going to turn it over to Ali to facilitate our Q&A session. Please remember to submit your questions using the Slido Q&A feature located in the bottom right-hand corner of your screen. Ali?
All right, thank you, Talia. So just as a reminder, we would encourage for state-specific questions about mandatory reporting that those would be sent to the MAC Quality TA mailbox. Those can best be addressed through that method, but we will jump into the questions that we've gotten so far from this webinar. So the first question I'm going to pass to Mary Beth to answer. It's about TMSIS reporting. The question is CMS still moving forward with using TMSIS to help report these measures? Mary Beth?
Thank you, Ali. So we are continuing to assess whether TMSIS is a viable option to report measures for states. And this is something that we're actively pursuing. We don't have any concrete update at this point. You know, we're assessing not just TMSIS and the data in TMSIS, but also the timing of data availability in TMSIS and how that aligns with the core set timelines as well. So we'll definitely share any updates in this space, but please know that this is something that we are definitely still looking into to see if there's any viability in using TMSIS for reporting of core set measures.
Okay, thank you, Mary Beth. We also received a question regarding separate chip reporting for the from conception to end of pregnancy, formerly the CHIP unborn population. For this question, I'm going to encourage you to reach out directly to the MAC Quality TA mailbox so we can discuss your state-specific situation and also the measure eligible population for each measure. So if you wouldn't mind sending that to the MAC Quality TA mailbox, we'd be happy to answer that question there. Right. We also received another question related to separate CHIP reporting for the adult population. So I'm going to also turn this one to Mary Beth. The question is whether it's possible to provide any forward guidance, whether CMS plans to require breaking out the adult core set measures by separate CHIP status. So I'll pass that to you, Mary Beth.
Great, thank you so much, Allie. So at this time, we don't have an update. There's no change right now. We appreciate the question and will provide any updated information if there is any to share. So thank you again for raising the question.
Okay, we have received a few questions related to stratified reporting in the QMR system. So a couple of questions related to the new OMB statistical policy directive. So just to clarify, so for 2024 reporting, the stratification categories will align with the previous guidance. So those categories are not changing for 2024 stratified reporting. They'll look the same as they have in previous years. And as a reminder, this is encouraged, but not mandatory. States can also use the add another option to define reporting categories if needed. And we also encourage you to reach out to the MAC Quality TA mailbox if you have any specific questions about how to structure your data. In terms of the new policy guidance, so that's referring to the new OMB statistical policy guidance, SPD 15. That guidance provided 5 years for compliance with reporting, and CMS plans to include an option to report the new categories for 2025 reporting, but states will have the option still at that point. And CMS plans to release additional guidance for 2025 reporting in the coming months. So just to clarify again, for 2024 reporting, the categories will remain the same as they have been in previous years. All right. Let's see, we received a couple of questions actually about dual Medicare, Medicaid dual eligibles and whether or not they are required to be included in reporting. So for 2024 reporting, CMS has exempted this population from reporting. So states are encouraged to report on those dual eligible members if they have the data available, but it is not part of the mandatory reporting requirements. Those populations are exempt from the requirements for this first year of mandatory reporting. Okay, we received a question. I'm going to pass this one to David. The question asks how to create an account and enter measures in the QMR system.
Yeah, so the QMR system utilizes IDM as an authentication platform. So we'll provide some additional instructions on yep, there we go. Thank you. Quick start within the IDM. So you'll need to create an IDM login, and there will be a flow to request access to the QMR application. And once that's done, it'll be available to you.
Thanks, David. And we have another question about downloading data that I'm going to pass to you. So it asks, is it possible in the QMR system to download the prior year data that was entered, or is there a report that we can enter in the QMR system?
Yeah, downloading it is possible. So at the beginning of the demo, I kind of mentioned that you can click on the home page for reporting year, and you can select between the current reporting year and the past three. You would select into any of those past three, and then on the landing page, there is three little dots. And actually, do you mind if I just share my screen real quick? I'll do that.
That would be super helpful.
Okay,
I think that might help with another question too.
yeah. So when you're on this page and you've landed on the landing page, you can go in between reporting years here. So in this case, I would hit 2023. And on this part, you can export the measures. So I would click this, and it's going to create an PDF that I can print or save that includes all of the measures that have been entered for the previous year. You mentioned there might be another question that I can answer.
Yeah, thanks, David. So there's a question asking if it's possible to get a list of the questions for each measure so that they can send out a tool to the MCOs and provide information in September. And so I guess I was thinking kind of relating to that PDF feature, although there is some path dependency. So I guess I'll pass it to you, but the question is whether it's possible to see all the questions in advance so that it can be shared with their MCOs.
Yes. So there again, back to like there are some question dependencies. So I'll give you an example of kind of how that impacts the export. Like if you were to just log in today and have not done any measures yet and tried to export. So in this case, I did do AABCH, so you can see kind of all the questions that are available to be answered. Granted, some of these are expanded questions, so you'll only see the first level. So like in this situation, if I were to hit no in the actual measure, there's a couple of extra questions. So they're not all expanded, but whatever questions are available in the default state would show up if you were to export right away. If you wanted to get to a point of maybe getting as much of the potential information possible, you would want to go into each measure and at least get to the point where the NDR sets are showing down here. So a lot of that is dependent on your measurement specification selection. So you would need to go into each measure and at least get to the point where these NDR sets are showing. But again, there are still like dependent questions that exist below that. So when we start talking about optional measure stratifications, obviously there's nothing that I can see here, but I know that there's additional questions there. So you'd get probably about 80% of the questions not related to, optional measure stratification or any of the subset ones, as long as you go into the measures themselves and make the selections that are necessary to get those additional fields showing. If you were to go to another one, you can see this is one that has not had any questions answered, and you can see that it's lacking kind of the NDR set and some of the additional questions as well.
Thanks, David. That was really helpful to see. The questions are starting to trickle. I'm not seeing any new ones come in, but we'll just give it one more moment in case folks are still typing to see if any further questions come in. Sure. Can we go back to slide 85, the previous slide? We got a request to go back to this slide. So this is the slide that has all of the technical assistance mailboxes that you'll need. So the first one is for technical questions about the system. The next one is for content related questions. And then the third one is the mailbox that the state previews will come from. And there's another question about whether the links provided in the chat box will be emailed or provided as part of the PowerPoint. So we will plan to include those hyperlinks. All of the hyperlinks are in the PowerPoint, and those will be available when the slides are posted on Medicaid.gov in the coming weeks. Okay, well, we haven't received any new questions. Again, we encourage anyone who has a question that they didn't get the chance to ask today to feel free to reach out to one of those mailboxes on the screen. We'll make sure it gets directed to the right place. And again, we just want to thank everybody so much for their time, and we look forward to working with you again this year for your reporting. Thanks everyone, and have a nice rest of your day. Take care.